So I'm Dr. Stephanie White. I'm the Chief Health Officer for Chicago Public Schools, and I oversee the Office of Student Health and Wellness. And we're extremely ecstatic to have you here today at the launch of our Healthy CPS Public Education Initiative. Before we begin, I'd like to bring up the principal here at Gonzales, Principal Kim, to speak to us and welcome us today.
Good morning, everyone. Today is actually a very festive day inside and outside of our school. Welcome to Gonzales Scholastic Academy. Actually, before I came to Gonzales about 5 years ago, at our previous school at Lloyd, we had started having recess. As a staff, we talked about how we needed to invest in the wellness of our children. And the educators that we have in CPS and at that particular school decided to bank 8 minutes a day so that the day would be longer and it would allot for recess during the day. And that was about 5 years ago. Since that time, it's great to see that the Office of Student Health and Wellness has mobilized like a real strong army within our district, within this large district, to really bring forth the importance of student health and wellness for all of our children in Chicago. In that, Gonzales Scholastic Academy is really a recipient of all the hard work, the ideas, the partnerships that this office and the staff members under the leadership of Dr. White have worked through the many months and years leading up to today. And so we're really glad to have you here and to know that we're part of a movement, an initiative to bring really, to make this generation of students not be what our scientists say that they will be, the first generation of American children that will not outlive their parents due to health and wellness concerns. So because of that, we're really excited about what's going to be shared today and the programs and the initiatives that are happening. For example, at Gonzales, we have the 30 plus 20 plus 10 program where our students get an average of 30 minutes of physical education a day, 20 minutes of recess every day, and 10 minutes of physical activity throughout each school day. And that is something that is a part of a process and a journey that we're all embarking on, but we're really grateful about that. Also, as a result of the work that is happening in CPS, our parents are more invested in how they should live, both as role models for our children when it comes to health and wellness. So as a result, we have Zumba classes and aerobics classes, cooking classes. One of our parents actually will be offering a workshop in June on how to purchase healthier items when they go to the grocery store, for example, so that they can be able to cook those healthier meals at home as well. We have a healthy kids market as well every Thursday afternoon in which parents get healthy produce for them to really utilize at home for free as well. So this conversation about wellness is really taking off, and it wouldn't be possible unless the students of our students at Gonzales were interested in it as well, but also if the Office of Student Health and Wellness wasn't really working hard to achieve this goal. So we want to thank you more than anything for being here, and we hope that what is shared today can be promoted outside of the walls of Gonzales into the rest of CPS, and we look forward to measuring our growth over the years to come as well. So we know that the impact here at Gonzales has been tremendous, and hopefully you'll get to see that today as well. So thank you so much and welcome once again.
Thank you, Principal Kim. Clearly, Gonzales is a shining example of how integrating health and wellness into the school culture has a phenomenal impact. And I'd like to talk to you about that a little bit more as I give you a background over the Office of Student Health and Wellness and our efforts, as well as Healthy CPS. So the mission of the Office of Student Health and Wellness, quite simply, is to remove health-related barriers to learning so that our CPS students will succeed in college, career, and life. And our vision is that we'll create this healthy CPS that serves as a national benchmark for student health and wellness. We know that the families that we serve are predominantly low income and that nearly 50% of our students are overweight and obese. And so to address these health disparities that our families and children are facing, our office has launched this Healthy CPS initiative in 2012. Healthy CPS, however, is an initiative, a part of a broader public health agenda that our city has put forth called Healthy Chicago. And Healthy Chicago focuses on 12 key priority areas that are a part of Healthy People 2020. So we've made a commitment as a city, as well as a district, to really improve the health of our residents and our students. So Healthy CPS aims to increase school capacity, to provide students with quality health services, and create healthy school environments that foster academic achievement. We do this primarily through 5 major goals. They are health and wellness policies, partnerships, health services, school supports, and then health and wellness promotion. So as we talk about health and wellness policies, we're setting standards that impact student health and wellness, and again, support student achievement or academic achievement. In our partnerships, we establish and maintain relationships with external organizations to provide health and wellness programming and services in our schools. We engage a coalition to help get the work done. Clearly, we can't do it all, and we want to expand our bandwidth. And there's so many vital community organizations and external partnerships committed to health and wellness, and we leverage that resource and support to really help achieve this one overarching goal. And then as far as health services, we are coordinating systems and facilitating access to quality healthcare services and healthcare providers for our students in schools. As we talk about the impact on health and academics, if little Johnny can't see the board, he's not going to learn to read. So if we can facilitate vision exams, ensuring that students have glasses, dental exams, ensuring that they aren't missing school because they're in dental pain, these are all critical factors that impact student achievement. And school supports. Principal Kim did a great job of highlighting some of the great things that are going on here at Gonzales and really gave a nice applause to my team. But the reality is that in order for this movement to happen, in order for us to really prioritize health and wellness, we have to provide a support for our principals and for our schools in order to help move the needle on this. And so we've really worked with schools to build capacity and to support student health and student wellness objectives through procedural guidance, technical assistance, resources, as well as trainings. That's been a core focus of the work that we do. And the 5th, again, was health and wellness promotions. We are the champions of awareness for this cause. Again, we're very mission driven. We truly believe in the work that we do, and we know that health impacts academics, and we want to remove any barrier that health and wellness might play such that our educators can be in the classroom focusing entirely on providing instruction for our students. And so we're mobilizing these efforts to support student achievement and now while in school, but also setting them up so they can achieve a lifelong existence of health, of being healthy and being successful. So if we talk about why we're here today, we're here for our public education initiative, and this has been made possible with funding from the Centers for Disease Control and Prevention. And Healthy CPS includes this public education initiative, which is aimed to reach 500,000 people in Chicago to inform them on 3 key things. The first is the efforts of Healthy CPS throughout the district in creating this environment for healthier school environments, as well as how this effort will support academic achievement for our students. A great example of this is how the district over the last few years has made wonderful strides. We recently passed the policy for daily physical education. We are increasing physical activity throughout the school day that aligns with Common Core, and we actually have someone from my team here today who will give you a wonderful example of what that actually looks like. And we're targeting healthy celebrations and healthy fundraisers, again, addressing the culture in schools. So instead of having candy for sale at Valentine's Day, schools have been doing wonderful adventures as selling cuties, having a cutie for a cutie, and allowing that to be the sale. So really shifting how we do our celebrations so the focus is more healthful, as well as addressing healthy school food as we work in partnership with our Office of Nutrition Support Services. The second way that we want to, the second purpose of this public education initiative is to let parents know how they can not only support Healthy CPS, but support it in their homes as well as at schools. And examples include the fact that Each school should have a school wellness team based on their local school, based upon our local school wellness policy. So the local school wellness team is a wonderful opportunity for parents to engage and be a part of the movement and the culture of the school building and help drive these efforts forward. Again, Principal Kim gave a phenomenal example of parents here at Gonzales engaging in how to shop healthier and do better food preparation. And the third factor would be engaging the youth voice. We're talking about crafting this environment for our students, but the students need to have a voice in this as well. And we're showing with Healthy CPS, we're showing how youth can engage and encourage support, in particular around tobacco-free neighborhoods through the Shy Don't campaign. And we have Kate Sheridan here from the Respiratory Health Association who'll speak to you about that in just a second. So what do we know? We know the benefits of healthy eating and we know the benefits of physical activity. And they include improved health benefits overall, enhanced academic achievement, increased concentration and awareness when in the academic setting, and that students who consume nutritious foods rich in protein, vitamins, and minerals, perform better, and that students who've had physical activity perform better and received a full grade level higher in reading comprehension compared to those peers who did not have that same physical activity. So research has clearly demonstrated and has clearly demonstrated that being active and eating right, children learn better. So healthy students learn better. So if there's some key messages that I want you to walk away with today, I'll highlight that physical activity plus the right foods supercharge your child for learning. That healthy students learn better. And that Healthy CPS is providing physical activity in all grades and recess for younger students daily. And that Healthy CPS is working to ensure that all foods and drinks provided on school grounds are healthy. Again, healthy students learn better. And then we want our families to support these efforts, to support Healthy CPS at home by providing nutritious foods and encouraging physical activity for your child. So this initiative will include TV and radio, public service announcements throughout through the members of the Illinois Broadcast Association. And announcements will also be in select community papers with online digital banners, billboards, CTA, tails and rails. You see examples of those sitting down front, and interior announcements. So to learn more about Healthy CPS, though, and this public education initiative, please visit the cps.edu/healthycps website. And to learn more about Shy Don't, please visit chidont.org. So at this point, I'd like to introduce Kate Sheridan, who is the Senior Director for Programs and Policy at the Respiratory Health Association of Metropolitan Chicago, and she's going to come forth and speak more on our Shy Don't Tobacco Prevention Campaign overview. Kate?
Well, good morning, everyone. Thank you for having me today. I'd first like to thank Dr. White again for letting Respiratory Health Association be a part of all this exciting work, and also to the Office of Student Health and Wellness for your continued support. A little bit about us. Respiratory Health Association has been Chicago's lung health leader since 1906. Our mission is to prevent lung disease and promote lung health through research, advocacy, and education. We do that through a number of programs. We worked in Chicago Public Schools for quite a while with some of our asthma-based work. We reach 1,000 students every year through our Fight Asthma Now program, and then we educate an additional 2,000 adults, parents, teachers, and staff through asthma management. And when Healthy CPS was being conceived, we really thought about, in addition to active living and healthy eating, that we really wanted to focus on tobacco use and prevention. So when we think about keeping our children healthy, and really a big piece of that is tobacco prevention. So tobacco use is still the leading cause of preventable death, disability, and all other things in the United States. And we know that 90% of tobacco users begin before the age of 18. So when we think about evidence-based and research, preventing tobacco use is really crucial for our young people and for maintaining their health so that they can be better learners. In addition to that, we think about exposure to secondhand smoke. So young people may be exposed to secondhand smoke in their homes, in other environments as well. So those are sort of the key things that we really focus on when we're thinking about tobacco use and prevention for our young people. And so what we really wanted to do is to supplement some of the healthy CPS activities surrounding healthy eating and active living with a concentrated effort on tobacco prevention. And we've learned a great deal throughout the years in this space. So we know how you can or cannot talk to young people. In the city of Chicago, we see young people beginning to use at about 11, 12 years old. And so we know that you have to talk to teens and tweens, as we call them, very carefully. It's very important that messages really resonate with them, in that it doesn't feel like an adult speaking to them, that they're doing some self-discovery, and really that the messaging and the tone is right. So when we were thinking about this effort and planning our campaign, it was really important for us to partner with additional experts. So I'd like to thank very much our agency partners, Jane Agency, who are here with me today. Brooke Foley, Bryn Ray, and Stacey Dupree are here from Jane, and they are the creative that rocks behind this campaign. So I want to thank them for their support in being here, and I'm delighted to show the campaign and sort of let it speak for itself. Again, we really wanted to focus our efforts here on students and youth. So 11 to 17 years old, because again, we see that first initiation at about 11 years old, and then we see it continuing. So again, really thinking about promoting tobacco-free environments, so in the home, in parks, outdoors, at CPS, and then also empowering students to know that they deserve those tobacco-free environments, in addition to educating about the dangers of tobacco use and secondhand smoke. So we really focused our messaging on that sense of empowerment. Again, from a student voice, a student telling Chicago that, I am tobacco-free, I deserve to be tobacco-free, and join me in my efforts in standing up for a tobacco-free Chicago. So our campaign really carries across environments and talks about, don't puff by my park, don't smoke by my school, don't chew on my corner, don't dip by my dugout, and don't vape in my view. Another key element for us in developing our campaign is it's really important to meet youth where they're at. And we know that youth in Chicago are using multiple tobacco products, not just cigarettes. So it was very important for us to include all of that in our messaging. And that's again why you see the representation of a chew and a dip, in addition to an electronic cigarette, not vaping as well. So our effort is really concentrated on 20 pilot schools that we selected based on a little bit higher risk for tobacco use, and we have a very highly geo-targeted out-of-home strategy so that we've kind of wrapped around those particular schools. We hope to supplement that with in-school placement as well. And in addition to that, we do have some district-wide placement as well, so that all youth are getting messages. And again, our key goals are to educate students and staff and parents about the dangers of tobacco use and secondhand smoke. To do that, to really empower them to know that they do deserve tobacco-free environments, and also to enforce CPS's current tobacco-free campus policy. So, the creative is here that you can see, and again, thank you so much to our partners at Jane for their hard work on this effort. We're delighted to be a part of Healthy CPS. So thank you to, again, Dr. White and the Office of Student Health and Wellness. And we've been live as a 5-1 with a very concentrated effort through the end of this school year. We've already had 1.5 million impressions, and we're hoping to really target and reach that key core group of 6,000 students, in addition to some district-wide efforts. So as you see us around town, hashtag ShyDon't, and for more information, it's shydon't.org, CHIDONT.org, and you can also check back with the Respiratory Health Association. So thank you so much for having us.
So I'd be remiss with my background in asthma if I didn't draw the parallel, as yesterday was World Asthma Day, And we talk about tobacco and tobacco exposure and asthma being the leading cause of student absences throughout the nation. If we don't address tobacco, which is one of the largest triggers and irritants, we then impact a child's ability to be in school, to be focused, to be healthy, and to learn. So it's all full circle. And so at this time, I alluded to earlier that we talked about increasing physical activity in the classroom during the school day. So I'm going to bring to the stage Abby Rose, who's a school wellness specialist with the Office of Student Health and Wellness. And she's going to do a physical activity demonstration for you, things that are going on in our school buildings currently. Thanks.
Good morning, everybody. Thank you, Dr. White. Yes, my name is Abby, and I will be demonstrating with some wonderful students from Gonzales a typical physical activity intervention that we are promoting to do in classrooms. Our local school wellness policy recommends at least 10 minutes of in-class physical activity. And of course, we know that has health impacts for our students. But what a lot of people don't know is that using physical activity as a tool for teaching can be very effective. Up to 85% of school-age children are predominantly kinesthetic learners, meaning that they learn best through doing, experiencing. As well, brain functioning goes down after just 20 minutes of sitting sedentary or without moving. So frequent movement breaks is a great way to re-energize students and optimize the brain for learning. So we are gonna do an activity. It's called Tony Chestnut. It's really fun and engaging, but it also has a great academic connections to the core curriculum. As we're doing the activity, I invite you to join us. We are learning different academic concepts such as figurative language, proper nouns, homonyms, even body part awareness. So there's lots of good content in there, as well as the physical activity benefit. So I'd like to invite now the first grade students from Gonzales to come and join me. And I invite you all to also join me. There's plenty of room right by your seat. Nothing too intense, I promise. So I'm just gonna preview the movement a little bit. It is Tony Chestnut, so we're gonna start with our toes, knees, chest, and another name for a head is a nut. Again, figurative language. So that's the first part. Tony Chestnut, and then the next part is nose, I love you. All right, you guys ready? Okay.
they awesome? Did you guys get it? Toe, knee, chestnut, got it? Okay. So again, that simple brain break in the middle of the day allows kids to shake off any stress and just refocus when they sit back down and dive right into the exercise. I was surprised that Abby didn't say this when she was up here, but we know that if the bum's numb, the brain's the same. So this is the opportunity to keep everything moving. So again, thank you so much for being here today to learn about the Healthy CPS Public Education Initiative. Thank you for coming. We hope that you tweet about seeing this on any bus rails. If you see the the commercial, or if you see any print media on this, tweet and say, I just saw Healthy CPS, and include at Chi Public Schools, so we know that it's out there and people are aware. But we're really excited about this. And again, we are changing a culture. We're excited about highlighting the impact of health on academics, and this is one of the many ways that we're going about this as a district. If there are any questions, please feel free to ask. I love that. That means that we effectively communicated the message that we were sent here to do. So on that note, I'll end. Thanks again.